In New York or in the U.S., the census has been kind of launched a couple weeks ago, and people have been able to, and I hope a lot of you have been able to sign up online and start being counted. However, the actual census takers who go door to door are presented with a serious issue given the current state of things. So it'll be remain to be seen how this will play out. But that being said, it is of critical importance, and we'll get into that between now and over the next couple months. It's of critical importance for us to become more fully engaged and aware of why the census is important. And we think that this coronavirus pandemic brings that home. So, you I know that a lot of our communities have been hit hard. I know the Panamanian community has been hit hard. I've seen comments from folks in the Garifuna community and the Dominican community here in New York. I know in our respective home countries, it's quite not quite as bad as New York, but there's always a danger of things spiraling out of control, especially with the unknown that this is. Um, so yeah, if you guys will give me a second, I will be tapping in with Miss Worrell momentarily, and I hope that you guys stay with us for this conversation. This will be the first; it won't be the last, and we'll be having a couple other conversations over the next couple months. We're also working to get others engaged in this conversation and pushing this within our respective communities because the numbers that are counted are going to be of critical importance. A little background: in 2010, which was the last census here in the U.S., the Afro Latino uh, number, in other words, those self identified as Afro Latino, according to the U.S. Census, was about 25% of people. Of Latinos who selected who opted to select that as a marker or as an identifying criteria. There's going to be a couple new things that people will see if they've done the census before, and if you haven't done the census before, well, this will be an opportunity to get familiar with the process and the protocol. Um, so let's see if we can get the on search 1 second. Well, she'll be joining us momentarily. Um, so yeah, I'm hoping that this conversation will lead to some good questions, will lead to some thought, and to actually being able to take some of this information that we hope to be able to share back to our respective communities, back home, immediate family, friends. There's been a lot of hesitancy, I think, especially with those of us who have family and friends who are not documented in the United States, as to the likelihood that can be used, that would or can be used against us. Um, and so we'll get into some of that as well um, over the course of the next couple weeks and months. So it's going to be very important. Saludos desde Chocó, Colombia. Hello, morning, Shelley. How are
Good
you?
morning. How are you?
I'm well. Thank you for joining us. How's it going?
Good. It's rainy. You're in Brooklyn too, right?
Yeah, yep.
A rainy day, but and what are we like in week 4 of quarantine now? So yeah, things are good.
Good. Glad to hear. Glad to hear.
How are you doing? How are things
I
on your
I
end?
was as well as can be. I think everyone's trying to make the best of an once in a lifetime situation. Um, I know that some folks have been hit harder than others.
Hmm.
But I'm hopeful, and I get the sense that at least here in New York, and at least within our community, folks are recognizing the importance of staying at home and being safe. And while also supporting those of us, and there are many who can't stay home.
Right.
An interesting statistic that came up, there was that like only 40% of Black folk and Latino folk can actually afford to stay home or even are in a position to. So,
Yeah, the
you
corona
know,
has
um,
hit our community really, really, really hard.
absolutely, absolutely. Um, and um, and I wanted to jump off our campaign that we're working on, and you've been working on this for at least a year and change now. We've had the opportunity to start working with the Healthcare Education Project, which I mentioned previously, which is a
Hmm.
partnership with SEIU, the Healthcare Workers Union, and the Greater New York Hospital Association. And so we're thankful for them for being able to kind of help us get this word out into the community. And I think that, as weird as it might be, the timing of this pandemic, is interesting because it kind of, and the response served as a means of highlighting the importance, I think, and I hope to be able to relay this, um, highlighting the importance of participation in the census, um, in 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 allocating resources to our community. And so I think one of the best ways to get going with this is for maybe you to share with the community some things as to why the census is important for those who are not familiar or who don't know what exactly the census is used for.
Yeah, so thank you for being such an outstanding partner. We have been working on this for this partnership with Afro Latino Festival for since like last summer when you had your festival. So,
Hmm.
shout out to you for your thought leadership, and just sort of like getting in really early because the census is one of the most important things that happens the decennial that happens every 10 years. A few reasons, and the reason why I'm looking down is I'm looking at my notes here. I would say like a few reasons, like number one, $675 billion of federal funding every year is allocated based on census data, right? So that's a huge amount of money that's being allocated. Secondly, all of those monies are allocated for a number of services: healthcare, public transportation. So we're talking about all of our hospitals, right? MTA, right? And we're wondering why these things are, you know, sort of like where they are. It's because of census data. Schools,
Right.
right? So a big thing that has been coming up lately are devices for children in Black and brown communities. Why do they not have devices? Maybe those kids are not counted. And as we said, we both live in Brooklyn. On average, most of our census tracts are counting between 50 and 60%, right? So that means we're only receiving 50 to 60% of our allocated resources. Brooklyn was the most undercounted county in New York State for the 2010 census, and we're in one of the top 5 undercounts in the country. Really, really problematic for our communities, particularly since Brooklyn is home to such a large Black and Brown community, including Afro
Right.
Latino. So, really, really important for
Right.
us to be completing. this form.
Very, very. Um, yeah, some statistics kind of piggybacking on some of those numbers that you just shared with us. Some statistics that were shared with us by the healthcare education project is that our focus with this campaign will be on really mobilizing the everyone, but in particular the 18 to 29 year olds,
Mm-hmm.
and by their estimate, that was one of the most undercounted groups, but even more so specifically in particular zip codes. And it's funny because you see the maps going around with regards to where the pandemic is hitting hardest, and there's interestingly enough, but not surprisingly, a lot of overlap with a lot of the same zip codes and communities that have dealt with severe census undercounting. Um,
And just to
and
clarify, the 18 to 29 undercount is Black men, right? So that includes Afro Latino, Afro Caribbean, African
right,
American,
right, Afro
African,
Latinos, African Americans, absolutely, absolutely,
yeah.
and I mean, you can get a sense of the communities if you're, especially when you look at the zip codes. If you're from New York, you look at like Canarsie, you look at East New York, you look at Bed-Stuy, Crown Heights, up in the Bronx, Fordham, Lower East Side, Jamaica, Elmhurst. These are areas, Harlem. These are areas that are being affected, and so one of the things that I think is going to be important is to really try to, as you connecting these dots, to let people know like these are public services that are supposed to be at our disposal. But if we and this isn't obviously all on us, right? There are failures that abound. But the one small thing that we can do, small but critical thing, is participating in the census in
Mm-hmm.
order for there to be little to no excuse, because it is a stamp that we are here and that we do exist, and that these services, which are the responsibility of the government, which we pay taxes for, are provided to
Yeah,
us.
but if we don't complete the census, then it's like you don't exist. So those resources will not be
Exactly.
allocated, right? So whatever that particular demographic. So the other undercount, apart from Black men, 18 to 29, the other um, the other demographic that's extremely undercounted are children under the age of 5, right? So if you have children undercounted,
Mm.
and we're asking ourselves, why do we not have the adequate um, programs for them, whether it's early childhood or books, resources, after school programs, as well as even school lunches. Like school lunches is funded by census data, right? I mean, so if we're not counting our children and our youth.
Hospitals in New York, Brookdale, Kings County, Elmhurst, Harlem. I haven't heard, but I wouldn't be surprised if there's anecdotal information. Jacoby, Bronx, Lebanon. And not all of those are necessarily public. Maimonides, Kingsbrook. There was an article in
Mhm.
NPR about Kingsbrook and
Right.
nurses
Yep.
lacking PPE.
Yep.
But those are all in our communities, and they are, they're being vastly affected. One other thing that I think people need to or should be aware of, and if you could speak a little bit more to this, is how our electoral power is increased or reduced as a result of the census.
Yeah. So our actual representation at the federal level, so House of Representatives, are dictated and determined by census data, as is our voting precincts and our school districts. So a little interesting fact is in 2010 and 2000 respectively, New York lost 2 congressional seats, right? So in 2010 we lost 2 seats, and in 2000 we lost 2 seats, and that was directly tied to census data. So, in addition to
Mhm.
all of these other resources that we deserve, right? Public transport, education, healthcare, right? Senior services, youth services, all of this data really determines how we live for the next 10 years of our lives, right? I mean, there are no do-overs. I was at a community forum several months ago with Senator Myrie, and someone asked, well, can we query the census? Can we do a recount if the count doesn't come in accurately? No, we can't, right? I mean, it's done once, only once, and so now is the time. The timelines are shifting as of right now. We have through August 14th. However, there was a request put into Congress this week to extend that for another 60
Mm-hmm.
days. It takes about 10
Mm.
minutes. You just go to my2020census.gov. I typed it into the chat earlier, and you
Uh-huh.
complete the form for everyone in your household, from newborns to the elderly. If you live in a mixed use household, so there are a lot of interesting households in New York. There are people living in SROs. There are people who,
Mm-hmm.
or what we call like renting rooms or tenants. All of those people need to
Mm-hmm.
be on the form. We have to figure it out. There are apartments that are like broken up, people making rooms in their
Mm-hmm.
living rooms, and then there's a whole family living in there. So that household will only receive one form, but everyone somehow for that unit needs to appear on that form if we want all of the resources. The other thing that is critically important is that we're not sharing any data. So we're immigrants just like you. Well, I don't know if you were born in Panama, but I'm the daughter of two immigrants from the Caribbean. And so I'm
Mm-hmm.
representing the Caribbean at the Census Bureau, and I've been doing that since 2018. And, as a family, as a child or a person who came from an immigrant family, I know there could be concerns, right? Whether you're documented, undocumented. I was at a forum a few weeks ago where at the borough president's office before we were quarantined, where someone asked, or actually came up to me after my talk and said, well, I didn't know that the census was for me. Like, I thought it was only for American citizens or for people who were born here. The census is the intent of the census is to document every single person in the United States. We count everyone once, only once, and in the right place. And we are a statistical agency, so we're not out to send ICE or Homeland Security to figure out where you are. We're just trying to do a count so that we can um, allocate the appropriate resources, right, to everyone in the United States. And some of those are immigrant
Right.
services, right? So, in addition
Right.
to what I'm talking about, there are a number of nonprofit agencies that are servicing Black and Brown communities around immigration, around getting their green cards, around sort of assimilating into the United States. They depend on this data as well to get the funding that they need.
Mm-hmm. 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 Yeah. I think that's something that we're gonna have to really hone in on and drill down on, because I think that there is definitely a misconception and a fear, especially in this climate, of possible repercussions. And it's important that people understand that those fears are not invalid, certainly not. However, they are misplaced in the sense that the idea behind the statistical value of the census is literally, like we said, allocation of resources,
Mhm.
allocation of electoral power. Um, and
Here's the thing I want to say in addition about that, about sort of like those fears. We as census
mhm,
employees are sworn to confidentiality for life, right? So anyone working for the Bureau,
okay.
we are sworn to confidentiality for life. So if you, and you should be only sharing your census information either directly to my2020census.gov, that blue form that you
Mhm,
received in the mail, or with the census
mhm.
taker, and they will not be out in the field until mid-June. That timeline has been pushed back, right? If you share with
Got it.
anyone else,
Got it.
then we can't really guarantee that your information is protected. But we as employees, federal employees, are sworn to confidentiality. If we violate that confidentiality agreement, right, or oath, I should say
Mhm,
rather, then we're subject to a
mhm.
5-year term in federal prison or a $250,000 fine.
Got you. Got you. I think piggybacking on that, can you kind of share with us? I mean, we posted the what the website looked like, but I guess identifying markers, because I know there's going to be a lot of fraud in the sense that people are trying to collect census information and make it seem like they're census
Yeah.
takers, and then just dump that info. Can you share with us some identifying markers that folks in the community can be on the lookout for, or share with others who
Yeah, if
might get
you,
this
I mean,
dubious information?
here's the thing. If you suspect fraud, then there is actually a phone number and an email where you can call and you can just verify that this is actually an official census form or document. The same thing when if a census taker, when we get, and hopefully we don't have census takers coming to our house, because if you complete your form, then there's no need for an enumerator to come to your house, right?
Okay.
So like that's the
Okay.
thing. Like the only reason why they'll come knocking at your door and leave you either something on your doorknob or try to help you assist is because you have not completed your form. It has never been easier to complete the census. You can do it online, you could do it by
Right.
mail, or you could do it by phone, right? I mean, there are a number of people around the country. There are 59 languages, including Espanol, right? Creole,
Okay.
and a number of other
Yep.
languages that are available that you can complete the form directly in. So you don't even have to deal with the English form if you do not want to. That person, if you call in, if a senior or even some, a lot of children who immigrant children, they help their parents who may not be able to speak
Right.
English yet. When that person
Right.
picks up the phone in that language. But back to your question of fraud, if you suspect that information is not officially from the federal government, then we have an email, we have a hotline that you can just call and you can verify that person and or form is actually an official federal government form. The census is a division
Okay.
of the U.S. Department of Commerce.
Okay. Okay. Good to know. Good to know. Um, I think one of the things that I've seen, at least with, and maybe we can get into this, and this will lead us into another call, which hopefully we'll be able to have in a couple weeks.
Yeah.
But I think we can start to touch on um, some of the new elements for those people who have seen or have participated in the census before. Some of the new things that they might not be aware exist now,
Yep.
to kind of highlight those, and we can kind of dig deeper going forward.
Yeah. I mean, so one of the things, I actually have my form right here.
Hmm.
It's right here. This is what it looks like. Um,
Okay.
and so one of the things I'm most excited about, so people who know me know there are two things that I'm like passionate about, and that's the Caribbean and Brooklyn, which includes, of course, Latin America. My stepfather is Panamanian, so I shared that earlier this week with you. So question
Yeah.
number 7 is my favorite question on the census, because for the first time in U.S. history, you can now indicate your races, plus your country of origin. So what's your race?
You asking me?
Yeah,
Black,
what's your race?
African American, how is it defined on there? African American or black
It says
or
black or African American.
right?
So what's your race?
Black African American.
And what country are you from?
Well, born here, but I would put Panama.
Right, exactly. So I'm first generation as well. And so I was born here and I would put Trinidad, right? So
Okay.
this is the first
And
time.
so that it provides that outlet now, whereas before we were kind of stuck with not acknowledging kind of the totality
Correct,
of our identities.
correct, correct. Right. So we were sort of like lumped together
Important.
into, different category or categories, whereas
Right.
now you can indicate your country of origin, which I think is extremely important. So if you think about your festival, right? How many people come to your
Hmm.
festival every year?
Right. Yeah. Like, we have between across the whole weekend, we have like 2,000, 2,500 people.
Right. So I'm sure you want to sort of like slice and dice your demographics. You want to know, how many Afro Latinos live in New York or the tri-state area or even in America as you're sort of like planning out,
Mm-hmm.
right? So you want to know
Mm-hmm.
how many people from Panama, from Colombia, from Honduras,
Mm-hmm.
right? So,
Mm-hmm.
from the whole diaspora, Afro Latino,
Right.
and even, from DR, from Puerto Rico, like you want to know how many people from those countries are here. And so now, for the first
Mm-hmm.
time in US history, anyone who is an immigrant, or a descendant of immigrants can not only indicate their
Mm-hmm.
race or races, because the other thing, is that we can't assume that all Latinos are Black, right? Or all people from the Caribbean are
Mm-hmm.
Black. I mean, there are a number of
Mm-hmm.
races that comprise these regions. And so you can not only indicate your race, or races, then you can indicate your country or
Mm-hmm.
countries of origin. And there are a lot of people here because of it's New York. Like my younger brother is Panamanian and Trinidadian, right? So he
Mm-hmm.
can put in, of course, he is no longer with us, but if he were completing his form, he would put in Panama and Trinidad, or he could if
Right.
he wanted to.
Right. 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 And I think that's important, and definitely. It's definitely, and like I said, we're gonna get into that more, because I think part of the conversation with respect to Afro Latinidad is that constant, and I call it the evergreen conversation, where some folks conflate and or don't distinguish between race, ethnicity, and nationality, and this provides an opportunity, I think, for some clarity on that, and I think that's going to be important. I think it's going to be important, looking inwards when we speak about community, but also uh, the implications of a, a more accurate,
Mm-hmm.
taking of the survey. So that's going to be important.
And then we
One
share
of the
another thing
things
with you.
that,
So,
yeah,
just sort of like
absolutely.
scenario. 2 weeks ago, I received a call from one of the consulate generals, of the Caribbean, right? And,
Okay.
he asked me, he had a very specific request. He said, how many people from my country, Shelley, live in New York, the Northeast, and in the United States of America, right?
Mm-hmm.
So, I mean, there's a consulate general
Mm-hmm.
of Panama. I'm sure he wants to know, and all the
Right.
Latino countries, and I'm sure that they want to
Right.
know how many nationals they have living in this country and descendants. Like,
Right.
what are their, sort of like, what's their first and second generation reach?
Right. Right.
And so
What's
this
funny is
data
that
is critically, and that request came from his home government, right? Because of
from the
COVID.
government, it's
Right. So from the foreign ministry, because of COVID.
mm-hmm. Mm-hmm. Telling you how many of their folks are being affected. Yeah, no, it's interesting because a couple of years back, maybe several years back, I would say maybe 20 years ago, there was a movement amongst the Panamanian community and the Panamanian American community in Brooklyn to try to get more accurate count of those of us residing here. And I mean, since that time, the community has spread out, Maryland, California, Texas, Florida, et cetera, Atlanta. But for a long time, the Panamanian community was concentrated here, and there was an effort to, and so, fast forward to now, that would have been useful even from back, even
Mm-hmm.
20 years ago.
Mm-hmm.
So
Think
it's
about
good,
the
it's great
parade,
that
right?
it's finally here.
We worked with the parade as
Right.
well. Like, think about the Panamanian Parade, which is the largest Panamanian event in the United States, right?
In
Whether
the
it's the
US. Yep.
Panamanian Parade or the West Indian American Day Parade. And they need to
Hmm.
have this data, right? I mean, they need to do their
Right.
planning, but it's not only about cultural festivals, but think about anyone providing healthcare services, immigrant services, youth services. So if we wanted to come up with a, like, let's just say I wanted to start an organization that, sort of taught the history of Molas or Panamanian culture,
Hmm.
like I would need to have this
Hmm.
data, right?
Right. Right.
Similarly, if
Right.
I were dealing with first, um, just new people just arriving from Panama and teaching them how to speak English or how to get their green
Hmm.
card, or how to apply for a job and sort of like make it here in America, sort of like just get settled, to set up
Hmm.
credit and that kind of thing. Like I would need that data.
Right, right. Yeah, I think that I mean, the importance can't really be overstated. I mean, it's so fundamental, and we've seen, what happens when that data is inaccurate here. We're seeing it now, and I mean, the last 10, 20 years, we've seen it. I think in our respective countries, back home where there's been a push since 2000 for greater recognition of Afro Latinos, and we've seen that. I think in the U.S. in the last 7 to 10 years, this renewed push. But there's a reason for that, right? Like there's a reason why for us why we think that this is so critical. We try to tie this into our diaspora communities. As diaspora communities, we try to tie this in to what's happening back home. And the lack of recognition and acknowledgement of existence has led to, and not just in the instance of the pandemic, but historically has led to an abdication of responsibilities, again, lack of services being provided, and then you get even more granular, criminal justice issues not being addressed or being addressed in ways that are detrimental to our communities, and yeah, I mean, just a simple fact that I think, and folks um, may or may not agree, but the fact that the discourse has been that has traditionally been up until recently, and at least in popular culture, that Afro Latinos don't exist, belie and the fact that we are 1/3 of the population in Latin America, and a lot of us, not the majority, but a lot come to the United States or are descendants of folks in the United States. That information gets lost in the sauce, and unless we are participants in this process, it'll continue to be that way.
I mean, here's the thing that I've been
So
saying, and I say a lot to, like, I've been working with what we call the hard to count population. So that's the Caribbean and Latinos, right? So,
right,
and we sort of like know ourselves, we know our communities. Like, we have all of the aunties and uncles who are like, I'm moving back home, right? But they're still here like 15 years later, like 20 years later. Like, the thing is
right,
you're here now, and our objective is to
right,
count the population, and have a snapshot of that population. What does the population look like in 2020, so that we can do our planning for the next 10 years. And the other thing is, okay, like, let's
mm-hmm,
just say you do make it back home, because some people do make it back home, right? To
mm-hmm,
wherever, like, Trinidad,
mm-hmm,
Panama, DR, um,
mm-hmm,
Jamaica, even though they're in some countries, they're actually saying you should not come back because it's not safe, but that's a whole different conversation.
right,
But the point is, even if you make it back, let's just say you and your husband, wife, that kind of thing, you still have a whole bunch of family here. Do you not want them to have, like, your grandchildren and your children to have enough trains and buses and, schools and resources at their schools in order
absolutely,
to live a happy and fulfilling life that we deserve?
absolutely, 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 and that is the kind of the collective thinking that we definitely need now more than ever. Is looking at it from that perspective that even if you're not here, you're doing what you can to ensure that those who you love will have the benefit of you being counted. And look, the underbelly of this is, look, the demographics in our neighborhoods are changing, right? And not everyone has the same interests as not all new residents have the same interests as old residents, and vice versa.
Right.
And so, do you want to not be counted at all? Because somebody's going to make sure that they're counted,
Mm-hmm.
you know. And I think that's also something that people need to keep in mind. It's oftentimes seems helpless to displacement. This is an instance where you can do something about it. You can be heard.
Right. Right.
And I think that's also something that folks need to be aware of as
And
well.
it only takes 10
Um,
minutes. Like, I mean, actually, it
10
took me
minutes,
about
folks.
7 minutes. And so it's like 10 questions, 10 minutes. It determines the next 10 years of your life.
There you go. There you go. There you go. So yeah, I mean, I hope that everyone who's been watching has gotten something out of this. We're going to save this and post this up. We are going to have Miss Worrell back. This is our first, but this is not going to be our last,
Yeah.
and this has been great. I really appreciate this. We've been working on this for a while. I want to thank again the Healthcare Education Network. Everybody's been been doing the 7 p.m. clap. We've been doing it on our end, but wanna definitely shout out the healthcare workers, bus drivers. I have friends who work for MTA, who are dealing with a lot right now. Grocery workers, everyone, healthcare, people who are taking care of others' children's, parents who are home. Everyone, this isn't easy. This isn't easy, and we hope that we can come through this stronger with greater clarity, and in some cases just alive. But we keep pushing forward,
I wanted to
and
share some other information. So
please,
I'm just going to pull up a map here, just to kind of get
absolutely.
the count from today. I didn't do that this morning, but Brooklyn was lagging in terms of the city. Um, we are at, we're actually last, right? In this, in the city. To be honest,
All right, Brooklyn. We
right?
need everybody, but Brooklyn got to stand up.
We're last.
Brooklyn got to stand up.
The Bronx is actually doing relatively well. The city, I mean, all the other
All
boroughs,
right, BX.
but us. Um, so so yeah, I mean, I think it's really important for not only people in Brooklyn or in other boroughs, but like even tell your friends and family. Sorry, I'm just pulling, the data is slow, but just tell your friends and family to complete the census. We need to count everyone in the United States only once and in the right place. And that includes senior citizens.
Right.
I was, on Utica Avenue before we were all quarantined, and at a
Mm-hmm.
couple of adult daycare programs that were primarily
Mm-hmm.
Caribbean, and they give away food to the seniors, to the elders. So they were like
Right.
dancing, they're giving away food, and they had to give out numbers because everyone they didn't have enough food for everyone. And I imagine that that's tied to census data.
Right. Right, right. More likely than not, they didn't have enough of accounts, so they didn't get the sufficient resources allocated to them.
That's exactly right.
Yeah, and I mean this stuff. This is not pie in the sky stuff. This as real world hard consequences to our everyday existence and
Mm-hmm.
living and those that we love.
So the thing was, they were
Um,
giving out numbers. Let's say they had 200 seniors. They said we have 100 trips. We have
mm-hmm.
100 tickets. So only those first 100 got their, food, whatever they were giving away, right? And the other 100 did not.
Right, right,
The other thing
right,
everyone was talking
right.
about was housing, right? They all had questions about housing, but senior housing, nursing homes, all of that is determined by census data.
Hmm. And I'd be curious. I wonder if is the HPD lottery have impacted by
I'm
that?
sure indirectly, right? I'm sure,
Right,
it's sort of like trickles down from the federal level, down because it goes federal, state, and then city,
right,
right? So
right, right.
absolutely, absolutely.
I mean, it touches so much. It touches every corner. You know, yeah. We can't stress enough. That how critical this is.
The other thing is
Um.
we're sort of like beyond peak hiring, but we are hiring and the job start at $28 an hour. So you can go online
Oh.
and complete an application, and that application will be valid through the end of the census field operations. And so right now that's projected to last through October.
Okay. Okay. That's good to know. We'll share that information. We'll share that information again as well. I didn't realize that you guys were still doing that. That's
Well,
great.
I mean, you can actually apply through October, right? So I think it's important,
Got you.
especially as people are underemployed or starting
Right.
to lose income. They can go online
Right.
and just fill out an application. There are no guarantees. We're not hiring. Obviously, we can't hire everyone in the United States, but
Of
I
course.
think it's important for
That would be the census, right?
people to have their applications in, and also to indicate if they have any foreign language capabilities, right? So,
Skills.
and we're
All
only
right.
hiring people at a very sort of like hyper local level. So you'll be hired based on your census tract, your zip code. So if you live in Brooklyn, you're not going to be going to work in the Bronx. If you live in Staten Island, you're not going to work in Queens. You'll be working right in your community. So, I'm a great example of that. Though I oversee Caribbean partnerships in the New York region, which is comprised
Mm-hmm.
of 8 states plus Puerto Rico. So technically,
Mm-hmm.
like that's the region that I'm covering. But when you're
Mm-hmm.
but I'm at the regional level, right? But the
Mm-hmm.
the people who are
Mm-hmm.
working in the field, they are only being assigned based on their geography. And so Brooklyn, for example, is for north, east, south, and west, right? So if you're from East New York, Brownsville, Cypress Hills, you'll be over in East Brooklyn. If you're from Williamsburg, Bushwick, you'll be in North Brooklyn. If you're from Sunset Park,
Mm-hmm.
you're going to be in West Brooklyn. If you're like from Flatbush, Coney Island, you'll be in South Brooklyn.
Gotcha. Gotcha.
And
Gotcha.
that's how it's designed
Okay.
across the entire country. I'm just using Brooklyn as an example because I'm most
As an example. Gotcha. Okay. Okay. Well, folks, you heard it here. Please, we'll be sharing that information, but please check out the census. Shelley, could you share the website again
Yep.
with us?
Sorry, I'm on my phone, so I have to type it in.
Yeah, no, 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 no problem. We're gonna share it again. Please, folks, stay tuned for more posts. We are going to be trying to bring in folks to help us spread the word and help you spread the word, Shelley, and help the healthcare education project share the word, and do our part in getting the community mobilized. I think that's important, that how hyper local it is.
Mm-hmm.
Because folks sometimes worry like where I'm going to be, especially now with, travel being concerned. But again, this is one small way, but critically important way that each of us can do our part, to push for this and to help our community. So if you're feeling like everything is spiraling out of control, if you're feeling, certain hopelessness, this could help. I'm not saying that it will, but this is an important act of civic engagement.
Yeah, absolutely.
So
And thank you so much for your thought leadership and for your partnership. We're really, really grateful to work with organizations that are on the ground, that understand their communities and sort of their needs and how to help us get the word out, so we can ensure that we count everyone once, only once, and in the right place.
thank you very much, Shelley. Thank you for your time, and we will be back here. Everybody, stay tuned. We will be having Miss Worrell back very soon, and we'll be getting into a little bit more of the granular fine points of the census and of the technical aspects of it and what it means. So we thank you again.
Thank you. Bye.
All right. Have a good weekend, everyone. Please be safe, stay inside, and be well.